Welcome to the Modern Day Naturopath podcast with Dr. Sue. Real talk for those craving deep healing whilst living in a modern day society. You'll be equipped with knowledge to make profound mind-body shifts that utilize ancient wisdom and will facilitate your healing once and for all. Inspired by Dr. Sue's chronic illness journey and all the real and raw pearls she has learned along the way. Come as you are. It's never too late to start.
Welcome back. This is the Modern Day Naturopath podcast. This is Dr. Sue, and today I'm so super excited to have Dr. Jill Crista here with me. I want to talk to her today about the topic of mold because I call her a genius in this area. She is such an expert. Dr. Jill Crista is a pioneering naturopathic physician, best-selling author, devoted educator, and creative innovator. Her superpower is to make complex medical concepts simple and digestible for the average person. Dr. Jill's passion is to elevate the well-being of the planet by assisting in the healing of her inhabitants. She focuses on conditions that cause injury to the brain and the nervous system, including mold, PANDAS, Lyme disease, concussion, and post-COVID syndromes. Her books, podcasts, and online courses support those wanting concrete steps to conquer their health challenges. So I'd love you guys to press pause and follow her on Instagram so that you do not forget. Her Instagram handle is Dr. Jill Crista. It's DRJILL and then CRISTA. Welcome, Doc. Thank you so much for being here.
Thank you. I love chatting with you.
Yeah, I know. I love it. I'm so happy you're here today. I know we bumped into each other at the A4M conference in Vegas, I remember.
Yeah.
And I was learning about your new products, which we're definitely going to talk about. It's a line health. That's
a light.
Light.
Yeah. I'm all about the light. So
yes, I love that. I love that. I want to talk about your products when we get into some juicy stuff about mold and where you feel that they would be appropriate, because we've actually started to use your products with some of our patients, and I'd love to share some of the things that they've seen from using them. But I would love to know, before we get into some of these, mold topics that are not as often either talked about or not as understood, I'd love to know what motivated you and a little bit more of your story. A lot of naturopaths, they've had chronic illness. They've either had, certain things that then, of course, drove them into learning more. So I'd love to kind of hear your background and a little bit more about you.
Sure. I got into naturopathic medicine because that's kind of how I was raised. It was just sort of what I was used to. We saw a chiropractor in my little hometown, and he talked about nutrition and herbs and body work and, all of the things that we do as naturopathic doctors. So that was just sort of my, it was my how I was raised, and the way that my brain thought was that the best kind of doctors are the ones that are doing things holistically and looking at the whole body and that how they interact, and that there's emotions, there's mental, there's spirit. It's not just physical. So all of that was how I was brought up. And so when it was time to think about medical school, I didn't know at first that there was even a place where you could learn this, because my only experience was through a chiropractor who was more naturopathic in his ways. And I was working at a kind of a hippie bike shop, natural foods, grocery kind of thing. And the owner was a master herbalist. And I said, wow, wouldn't it be amazing to be able to go to medical school to learn this? And she was like, oh, she got so excited. And she brings me this book of all of the schools that she had wanted to go to learn to do just that, and didn't get a chance because of her kids. And so, yeah, I just at that moment made the commitment, I'm going to go to this naturopathic medical school thing. And it was just in alignment. When I read the philosophies, I was just like, yep, exactly. Do no harm, doctor as teacher, treat the cause. Every single one of the philosophies I was just in complete alignment with. And I am so thankful for my degree. I thank myself for it every day. I use it every day, and I can't even imagine what my life would be like without that training. So,
right.
Yeah.
And it's interesting when you say that too, because we think it's not just we go to naturopathic school, of course, to help patients, but we're also helping ourselves and our family and our friends. There's more than just the business aspect of, yeah, this is going to be my job, right? Because I'm going to
Right.
help.
Right.
I'm actually going to help myself. I'm going to then, it's like trickles into, because I don't know about you. I'll say I'm not talking about health stuff at this dinner. And then all of a sudden we're talking about health stuff
Yeah.
because, which is like, I find myself so annoying. I'm like, oh God, it's
There
like
we
some
go.
help ourselves to like spread it to some people. And it's like, it's like there's this like ripple effect of
Yeah.
us wanting to share it with so many people. What school did you go to? I went to SCNM. Where did you
Yeah.
go?
I went to NCNM in those
Oh,
days
yes.
in
Okay.
Portland. It's now NUNM. Yeah. Yeah.
Got it. Yeah, and most of us don't even know that those are available. Like, when I was looking into too, I didn't know, is there a school that actually teaches this stuff? And then when you find out, you're like, "Oh my god, this is the right fit," especially when we see those naturopathic philosophies.
Yeah.
And I just said to a patient yesterday, I said, although we go against the grain and there's so many hard things to explain to people, like, "Oh, this state is licensed. This I could do here. This I can't do here," and
Yeah.
trying to explain ourselves to medical doctors, even though it's like trudging through mud to, sometimes to do this job, I said I'd still choose it again because I can't imagine if I went to a conventional medical school. Do you agree with that? Do you feel like, yeah,
Yeah, and I mentor a lot of MDs, and they say that quite often of like, "Didn't learn this pathway. We didn't learn if it didn't have to do with a pharmaceutical, we didn't learn it." And so they didn't learn about a lot of the things. Not that, didn't learn, but didn't learn it in the way as this holistic viewpoint. So even in, because I did consider I could have gone to Georgetown. They had a, alternative medicine class, a single
hmm
4 credit class. And, my family is like, "Do you sure you want to go do this thing that nobody's heard of? And why don't you just go do a normal thing and then you can get additional training?" And I'm so glad that I didn't, because I think there is a bit of a brain programming that happens that makes you a really good prescriber, but then makes you almost fearful of doing some of these alternative things because the training just isn't there. Most medical
exactly.
schools don't even have a class in nutrition, in clinical nutrition, unless you're going to be a dietitian. So it's like, if we're going to put nutrients in someone's IV, we need to know that, or, in a feeding tube, we need to know that. But, how to run a whole body, and which is crazy to me because if you look at any machine, the fuel you put in it is super important. And, greasing the gears and all of those things that we do with bile and lymph flow. And, I just, again, I'm so, so grateful for it. And like you, it's almost like gospel for me
Yeah.
because I remember being in practice when I first started my practice. When you're not part of the system, you have to go start a business too. So you
Oh,
have to
for
be a
sure.
business expert, and which I was not a very good business expert. But I remember early on going to like something where I was giving education, and somebody said, "Well, blah 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 about your business." Kind of like, how are you running, or how are you doing hiring for your business? And I was like, "My business?
What do you mean?
No, it's my practice. It's like, this is my it's so much was part of what I wanted to do in this world and bring forward that I didn't even think of it that way,
Yeah, because you truly enjoyed it and you're passionate about it. I truly feel it's a calling because I don't
Oh,
think that there's people just don't go through this type of thing. And it was
no.
grueling for me. I was Oh my god, it was grueling. I was a business major who changed my career. I was working in advertising in Manhattan, and then all of a sudden was like, "Oh, I'm gonna be a health coach." And then I was a health coach, and then I'm like, "Oh, maybe I'll be a naturopath." And then it was all of a sudden I'm in Arizona from New York, and I'm doing this, and I was crying every day of probably the 4 years, being like, "Can I do this?" But then it's like,
Yeah,
"Oh, wait, I can do this." And I knew at that moment there was divine intervention behind it because
yeah,
I wasn't one of those people who I've known I wanted to be a doctor since I'm younger. So I didn't have those science, that science background that some of these people had that I was so intimidated by. That's how I knew that it was, I always say it was Jesus or some divine intervention because by the grace of God, I got through even being sick, right, with Lyme and all sorts of mycotoxin stuff, right? I didn't even know I had that stuff. So I do feel that when we become naturopaths, and I obviously am biased, but I feel like there's a special type of person that it's divinely guided to be able to help people the way that we do because it's not easy finding the root cause. It's not easy kind of putting those puzzle pieces together, and you certainly can't do them in 1 to 2 minutes in unfortunately in a minute clinic, right?
I I
Right?
love that term, a minute clinic. Wow, that's a good term.
Right? Right?
Yeah.
Because what are you really getting in, in that time frame? Um, Doc, did you were you one of the doctors who got sick with the thing that you now help people with, or were you just kind of led into mycotoxins from some other way? Like, how did you become this expert in mycotoxin illness?
Yeah, I was sick, became sick with it after I was already teaching about it. And that's what was so
Oh,
amazing is that the way that mold messes with your brain, it does this ninja mind trick, or Jedi mind trick where it's just like, it's not mold, like that I was actually doing my class, filming my class and, putting it together for my online course, my very first one, while we had a mold problem sprouting in my, at
wow.
that point, new to us house. And, yeah, it was just wild at how mold works, and it was like, "Oh, maybe this isn't perimenopause and my kid's going into, wacky puberty," and all the things that you're just like, "Right, this is mold.
It's
This is
just
what mold
toxic.
does,"
Yeah, that's what it looks like. And is that why, and now I recall hearing part of this story, is that why you made that mold meditation? Because I think you said kind of like what it's in your world, you kind of bring it to you.
Yeah.
So can you talk? I really would love some of my listeners to just hear a little bit about why you made this mold meditation and kind of what you were noticing energetically
Mhm.
about, that being called in because you were kind of inundated with it, especially
Yeah,
since you are dealing with that.
totally. I find that when mold comes into your life, there's something that you're not digesting. Yeah, there's something that you're not moving through. And that could be emotions, often that's emotions. That could be clutter. That could be that you're not slowing down and taking time to just like clean your home and do the things, the maintenance things. We get this like, got to keep going, go, 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 So there's a something that is not being addressed. And when we look at what mold does on the planet, it takes things that were useful once and are no longer actually useful and breaking them down into little nutrients that are very useful and feeding the forest floor again, So it's making sure that we don't have stacks and stacks and stacks of organic debris piled up in a forest. Well, if you look at a lot of our homes with, overabundance and affluenza, there's stuff all over the place. And so, of course, mold is like, oh, I know what to do here, so it likes to come in and help. And at the time we had gone through a very big loss in our family. And like, I was not addressing that. And so that was this kind of like mold was coming to help. Here, let me break this down for you and break it down into energy bits and particles so you can use it for other things, So I'm trying to like, put it in the physical and the energetic as well. And so what I noticed is that even though I knew you were not supposed to stay in your house while you remediate, I did.
Wow.
Got in my head. It got in my head big time. And so I made all the mistakes, like I could, someone said, I hope you will tell the story of all of the places where you
Yeah.
messed up, someday, because I took tons of pictures and, everything. I did a lot right, but also like for being a mold expert already, it was like, come on,
Yeah.
better.
Yeah. And sometimes I don't know, it's just your own worst patient sometimes. It's
Yeah,
just so hard to do things that you would do for someone else. The amount
right.
of like embarrassing things I feel like I've done, I'm like, really? I don't even want to see them out loud. Like, really? Am I a naturopath? So that's like, I just think, wow, because it's like, wow, I can't believe it's like, but you end up doing things that don't, especially when it's yourself. It's so hard.
So silly. Yeah. So
Right.
I just noticed that like, oh, and then like my rental had a water problem at the same time and a mold issue, all of these things. And then I noticed over and over again with patients, and it didn't really click to me until it happened to me, where I was like, it does get in your head. And it's almost like you get on a coherence with it. So you become tuned to the same radio station that mold is tuned to, which is why it was called in the first place, which, when I say that, a lot of people are like, I didn't call that in. That's a horrible experience, so I'm not trying to say it's your fault. I'm just saying that there is this thing about energy where if you're not minding it and you're not putting really intention into it, you can stumble into coherence with things that you did not intend. It was just that you were not paying attention to the energy, being very mindful about your day, being very mindful about how you want to be in the world and all of those things. So that's what happened in our world. And, life happens. And so it's not, we had a loss. I didn't call that in, that happened. So all these times then a patient that did their remediation and it didn't work, they had to come back 2 or 3 times, which is what happened in our house. Because they found more. It was like the more they dug, the more they found. Or they get put into a moldy rental. And while they're remediating, like into a hotel, the hotel is moldy. And so you start to get this thing in your head of like, everywhere's moldy, nowhere's safe. There's no, mold is ubiquitous, blah, blah, blah. False. There are many, many clean, beautiful, safe homes. It's that if you're continuing to interact with mold, you're in coherence with it. And so we need to mindfully, purposefully change the energetics. And you can only change the energetics of you. You can't change the energetic superconsciousness of the fungal world. They are a supreme intelligence. So what you can change is you. And so I created this meditation. And it was during the summer, actually, in Wisconsin. We had cicadas outside. And I was out there. And I don't know if you've ever experienced this, but in the Midwest, when the cicadas are out, it is like rattling, and from my shamanic and energetic training, I know that when you're trying to dismember something, you're trying to change a frequency, you need to rattle it, so it's not just always like, oh,
Yeah.
soft, but you gotta get in there and just,
In there.
and so that's why a lot of shaman, like traditional shaman, use a drum or a rattle or something, because we're trying to shake up the energy. And so that's what I did. I went outside to the cicadas and I was realizing they were like, shaka, 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 there's like kind of shaking, and I could feel it in my eardrum. And I was like, oh, hey guys, do you want to help me make a meditation?
Thanks for calling me right now. Thanks for talking to me. That's amazing.
So yeah, we have this meditation that uses the natural world to help you shake out of that coherence, and then using other types of I don't want to give it all away, but other things at the end to try to get you choosing your frequency and choosing it higher and more expanded than where mold is.
That's incredible. You have so
totally
that's available. It's free on your website. Okay,
Yes.
we'll definitely put the link for everybody. I
Yeah.
want to do this myself because I feel like everywhere I go, I end up being worried, and then there's mold. So I'm like, this is like a self-fulfilling prophecy.
Right, you're
And
projecting.
there's a part of like when you said before, there's a few things I really wanted to comment on. I love when you said there are plenty of places that are clean that are not moldy, because when you're in this moment of, oh my God, there's mold everywhere, because that has been your experience, you don't even almost believe that. And you're like, I'm doomed. I can't go anywhere. I'm going to stay in my house. I'm going to isolate, which perpetuates sickness, right? And that anxiety and the fear. And then also, I love when you said the shaking up shamanic, like through my time seeing shamans, there's always this like, and I don't know, but I can like actually feel that vibration when it's like the drumming or the shaking or that noise. You could just, it's this feeling that you can actually feel. It's like almost like my organs are shaking up when I hear that sound or that frequency, but it makes it sense to like shake shit up, basically. Like you got to shake it up, right? To get it out of you. And yeah, when you said too about when people are like, oh, well, I didn't call this in, or some people, and I hear patients, and I'll even do it myself, they get defensive, like, this is not my fault, but I also fear there's this, from a shamanic, right, perspective, right, every dis-ease, there's some emotional cause or emotional frequency issue before. So maybe while you consciously didn't do that, there are these subconscious things that maybe taking like that accountability. And sometimes it's hard because there's a lot of resistance around, no, well, I didn't do this. Now I'm being blamed for this. It's not to make you feel bad. It's to say, hey, maybe there's something underneath here, that there's this, there's this subconscious, right, that you just keep, like you said, bringing this kind of back in, that coherence. So I love that you offer this to people for free, which is amazing, because the nervous system work just in general, which I'd love to speak about that a little bit. The patients who you've seen who've had a lot of trauma or they're high anxiety, let's just say they've been anxious even their whole life, or and not just that mold put their brain on fire and they're anxious, but let's just say they have unresolved trauma or suppressed trauma, and then they then get sick with mold. Do you happen to see those people more sick. I end up seeing those people the sickest because there's already this nervous system dysregulation. So can you maybe speak to your experience on why the nervous system work is so important for people trying to heal from mycotoxin illness, or even whether it's acute or chronic?
Sure. Yeah, it's a very common pattern. If somebody is struggling through traumas, to then I feel like it's almost like the soul's attempt to clear the pattern is, let's revisit that again and see if there's something different that we can do to come out of it. It's almost like you get stuck in a spiral, and every time you come back around to that thing, that traumatizing event or that experience in mold or whatever, it's an opportunity to say, I'm going to choose a different lane here. I'm going to handle this one with more faith and trust and love and, all of these kind of the edge. And that's actually what my next book is all about, is the how of healing. Because my first two are like, what do you take? What's the order? What are the cautions? What's the dose? It's the
Yeah,
what.
yeah, yeah.
But the how is almost more important, how you heal. And I was sitting back to just pay attention to my patients who do all the same things. So similar exposure, similar age, family dynamics and everything like that. Why does one patient get better with all of the things that we're recommending and they need, maybe even the same amount of appointments or something like that. And then there's some that cannot shift or move. And that's when I came up with that meditation. It's called the Clarity Pep Talk, because I was like, I think part of it is coherence. So let's fix that part. But a huge part of it is that how part of healing. And when you've had significant trauma, you start to lose a sense of self-worth. And if that is not addressed, then you don't feel worth healing.
Yeah.
And that's so key. So it gets into that ranges into, like counseling, limbic looping, nervous system, always being kind of surveying and on guard and that kind of thing. So you don't get the parasympathetic part. And that is where we do our deepest healing, is the parasympathetic. So if the body's always in that sympathetic tone, the sympathetics are there to protect us from danger. That's why a cortisol surge can wake us up, but a melatonin surge can't make you go to sleep. It can't override. And if you hear the tiger, you need to get up and get moving, that kind of a thing. So the parasympathetic is a default system that can only function when the sympathetic is down, when it's let go. And so if you're in that place of, I have to be constantly vigilant, constantly surveying, constant, I'm not safe, which is what breathing mold toxins does, So if you have those going into your brain, your limbic system is saying, I'm not safe. So we go out, get out, like danger, danger, danger. But then your thinking brain goes and looks around and says, I don't see anything.
Right.
Smell anything. I don't hear anything. There's no tiger. So we're going to stop listening to you, limbic system. And then the limbic system just gets into a loop. We're not safe. We need somebody to pay attention to us here. And that can turn into sympathetic dominance. And then the parasympathetic, the rest, the healing, the repair, the immune system, that whole system can't run, because it's a default system for when the sympathetic is off.
Absolutely. I love that. And, when you said too, it's like the worthiness around healing, that's so common. I mean, this is why being a naturopath has so many benefits, because we're actually going and asking people these mind body questions. It's on our radar. But that's why I've written a lot of posts about, like, what's the secondary gain to your illness, right? Like, how is it serving you in a way, even subconsciously? Or I don't know, my mentor used to say, and I shared this on one of my other podcasts, every disease is curable, but every person is not, he used to say, because of that. Right. And I loved and it can be interpreted in a few different ways. How I interpret it is that you have to want to get better. But if there's this deep underlying trauma that's making you feel like you're not worthy of it, deserving of it, I say to people, I can give you magic in a pill, but I don't see that resolution of their symptoms until we get to that other stuff. Like, they'll get like 50% better with the physical stuff. And then I'm like, oh, well, did you go to EMDR? Did you do NAT? Did you do EFT? Did you do a meditation? They're like, oh, no, tomorrow. And then it's like,
I don't have time. I didn't. Yeah.
There's
Mm-hmm.
always something, and then they just want another supplement. And I'm like, that's where
Yeah.
the integrity of the naturopath. I'm like, I'm not going to sell you another supplement. You need to go get this trauma work done,
Mm-hmm.
so that they can regain that like sense of feeling worthy. Like and I actually am going to take this treatment in, and it's going to intracellularly actually help heal me.
Right.
Right? Think about all those like supplements people are taking, and nothing is shifting at all. Like
Right.
not even a little bit, right? So
And that's the how. That's the how part is like, you
how.
could be looking at that handful of supplements and you could be like, oh,
Yeah,
like I gotta swallow these down. And
yeah,
because someone told me, so an external source is
yep,
a teller to me that I have to do this. So to hear those words, have to, and it gets tricky when
sure.
we talk about like, we're not trying to make people blame people for their situation. It's the converse is we're trying to empower you to understand how to energy hack your way to wellness. And so paying attention to that, are you saying, my doctor told me I have to, so told me, have to, sigh. Oh, how am I going to put these? This is a whole way of taking supplements that is never going to have the supplement probably even open the capsule in your body,
Yeah,
or you could be like, oh, I'm so lucky that I had access to this doctor who empowered me with this information. And now look at these little magical
yeah,
gifts from earth that these are going to come in and help me and heal me. And it's going to be amazing. And I do look forward to the day where I don't have to take so many, but
yes,
for
yes.
right now, like I embrace it. And I'm so lucky I have access to this. No one told me.
I'm so happy you just said that. It's like the intention, right?
Totally. It's how you come toward it in gratefulness or in perpetuating trauma cycles. Because if you're taking it, any remedy, any EMDR, any whatever, with someone told me I have to do this, that's a trauma. That's an energetic that needs to be addressed in a gentle, loving, kind way. It's not your fault. And there are things that you can do to approach this a little bit differently. And there are many, many tools now. I mean, I love like social media and all that. Like Amy Appendinden has her trauma healing, and there's lots and lots of resources for people now. So it's really nice. Like we don't
Yeah.
have to just, if it's not in my little community, you don't have access to this. Now it's global. So take advantage.
Take
What a
advantage.
time to be alive.
I know. It's almost like overwhelming the amount of
Yeah.
resources that there are. Like before there weren't any at all. And I agree, right? And I agree with what you said. You have to want to, and it doesn't have to feel like a chore. Well, there's a part of it like, yeah, I'd love to not take 10 supplements a day.
Yeah.
But if I know, hey, this is temporary, this is healing for me. I really like the doctor who prescribed it. I understand why I'm taking it. And I don't know about you, I even tell patients who have to take a pharmaceutical, let's just say they're like, I don't want to take it, but let's just say it's one of those situations where it's either crisis care or they need a pharmaceutical. I
Mhm.
even just want them to say a prayer over it. Like, I don't know how you feel about that. Just the intention,
It's a
all the
gift.
good effects from this is going to come into me. I mean, there's nothing negative or however you want to say it that feels right to you. Right. So I only take the good from this and I let the rest, go. And
Yes.
feel like that even just with what you see as like a bad drug, right? I feel like I've done that even to myself when I've panicked through because as naturopaths we're like glorified, like we never want to take a poisonous thing ever, but we're humans too. So then when there's like a really, bad situation and we need a pharmaceutical, like I would literally say a prayer over it and it'd actually end up fine. Whereas I think if I freaked out into it, it would have been a completely different reaction. Do you agree?
Totally. Yep. Again, if
Yeah,
you start everything from an energetic standpoint, the what it is less important than the how you're doing it. Not that the what
absolutely.
isn't important. It's very important. We do have biochemistry. We do have
Right.
can you meditate your way to health? We probably have that capability. I don't know a whole lot of people that have honed that skill to where they can actually change their physiology or the genetics. I do know a few people who have done that, but for the average muggle, we're we need
Yeah.
we need the remedies and the nutrients and that kind of thing. But doing them together hedges your bet.
Yeah, for sure. And you said two books. What are the names of them that are the ones that tell you the what, like you just said, like you
Yeah,
know,
the
what
what
to
to do.
take and what to do. And then, yeah, I would love to know those. What are those two names?
Yep. So the first one is on mold. It's called Break the Mold. And
Okay.
it's 5 tools to conquer mold and take back your health. So it's just basically breaking it down. I'm very into having things be actionable. So in the book, it takes you through each of the 5 ways or 5 steps. And then when you get to like picking one thing over another, like why would I choose resveratrol over quercetin? Maybe I need both. And so there's like little tips in there and what kind of symptoms that particular nutrient or herb or whatever helps. And then there's a dose, and then there's a caution, like if you have certain other things like blood pressure issues or whatever. So it takes people through the whole process. And I get emails all the time like, put my whole family on this and we're recovered, thank you, thank you, thank you. Because you don't really, a lot of people can get better from this without having to see a doctor, which I'm not saying don't see a doctor because it's
Right.
great to have that guidance. But if you don't have access
Yeah.
to a mold literate doctor, you could at least get started. And for a
Yeah.
lot of
You
families,
DIY, right?
yeah,
Like do it
right.
yourself.
It's totally DIY. Yeah. And
I
then the
mean,
other is very similar, but it's about pandas and pans. So it's called A Light in the Dark for Pandas and Pans. And that also goes through my core 4 of treatment. It gives you a whole section on homeopathics for pandas and pans. And again, dosing, duration, what to do, the dose in a flare versus a maintenance dose. And I'm really proud of both those books because they're very actionable. But
that's
I do see that
incredible.
there's need for the how
The
part.
How book. So the
Yeah,
How book is not out yet.
not out yet.
Okay.
Yeah, it'll be
So
this fall.
that's coming. Okay. So we'll stay tuned on that one. But these are amazing. How can they purchase these 2 books?
They can get them off my website or any bookseller. So Amazon, Barnes and Noble, all of those. I have the audiobook done on the Break the Mold, which I read it, which was really fun. So, if you can stand to listen to my voice that long.
That's amazing.
Yeah. And then
Yeah.
ebooks in both. And then I still have to record I have to listen. Oh, listen to that.
Oh, you said
Yes,
have to. You said
I
have
get
to.
to record the Pandas book. Yeah.
That's amazing. And it's for a lot of us who are like doing computer work and reading all day, it's so nice to have a book that you could just listen to wherever you want, whether you're taking a walk or in the car. So that's
Yeah.
amazing. And then speaking of, I want to go into a little bit. I have so many things to ask you about. My God, I'm like, I wish I had like 5 hours here. Um, I want to talk to you more about the neuro world. So like you just mentioned about the pans, and then I want to talk to you just a little bit about the Parkinson's. I saw that reel I was telling you on Instagram. I was like bored. So give me a little bit of a background, please, on where this panda like where you started with that, like what inspired that, and what are you doing to help people with that?
So I am a mom of twins with PANS, and that's
Oh,
from they're 25 now. So we've been working on that for 22 years. And that was in the trenches learning for sure, because there wasn't very much information about it at all. And for my kids, we're really kind of we shouldn't be using the term PANS because it started with congenital Lyme. So I had Lyme disease, but I didn't know it. I have, quote, fibromyalgia, and gave them Lyme in utero. So handed down the Lyme to the babies, Bartonella, Babesia, all the good things. And then they developed this neurological problem, and then eventually the autoimmune disease where they're with pandas and pans, the immune system starts attacking the basal ganglia of the brain. So, and we think maybe some kidney things too, but for sure it's the basal ganglia in the brain. So it's probably will eventually be called basal ganglia encephalitis in the end, where they'll just have that as the umbrella term, and then there will be flavors of that, depending on what was the triggering infection or toxin that started it out. So the connection with mold is that mold can make us sick with mold spores, with fragments, with the chemicals that it's off-gassing, like alcohols and aldehydes and things like that. And then there's a really important one called a mycotoxin, which is made on purpose by mold to defend its territory. And it's made as a bioweapon by mold to kill the other mold species in the environment. So it finds that humid area in your house. It's like lakefront property. And it's like, I want this out of myself, because when mold gets out of nature, it doesn't act naturally. So normally it's working really commensally with a forest, and it has that mycelial network of mushrooms underneath that's making sure, like, okay, this is your job and this is your job. And it has, outside there's air movement, there's light, there's, insects that drink extra water. So we don't really have that inside. And so mold is like, wow, I have all this stagnant air. Like, it's perfect conditions for the mold because it's stagnant. There's very little sun. There's, humidity, and then this organic material that it's like, sweet, I'll just get to work doing my job, but I want my own colony, which is out of nature, rather than in community. I want to be in my own colony. And so it starts poisoning the other mold species. So those mycotoxins are neurotoxic. So they are poisonous to the nervous system, and that is your brain, your spinal cord, and all the nerves that leave from there out to the tips of your fingers. And the connection with PANDAS and PANS is that many of them can go through the blood-brain barrier. And where they ride it actually by the nose. We have a cranial nerve that goes from the basal ganglia. It spins around. It's the olfactory bulb, so it's our smell nerve. And it goes all around the basal ganglia. It's got this really circuitous route, and then it reaches forward and it goes down with little bare hairs in your nose so that we can smell stuff. So when we're smelling is a form of physical contact. Like, we're actually having a molecular reaction or connection with something on that nerve fiber that says, this smells like a rose, or this smells like a baby diaper, like it's depends. But either way, you interacted with that molecule, which is really gross to think about when you think about smelling a baby. Like, now you're like, oh, gross, that was actually coming. And mycotoxins, because they're fat soluble, they can absorb into those bare nerve fibers, and they get an elevator ride right into the brain. And so we see a very, very, very high rate of kids with PANS and PANDAS. So PANDAS is triggered by strep. PANS is triggered by, fill in the blank. It could be mycoplasma, could be flu, could be COVID. But I have seen that the environmental triggers are not getting talked about enough. And mold is a huge one because of that mechanism with the neurotoxins. Mycotoxins being neurotoxic, they get a pre-ride up into the brain in the basal ganglia, and they exert their neurotoxic effect there. And then the secondary response is the body says, whoa, we need to send a bunch of mast cells to get rid of this.
Okay.
And then mast cells in the brain triggering microglia. Yeah. It's
so that's where the mast cell, and then it just lights their brain even more on fire. Oh my God, this is
you get that entourage effect of just like the mast cell leaks out its inflammatory granules, which triggers more inflammation. And so it just boom, boom, boom. Yeah. So I kind of think of them as like cluster bombs. The one bomb can go off, but then there's little granules that can also degranulate and excrete all this inflammatory stuff. So,
but even just, let's just say it's not PANS or PANS, it's just even just listening to that in general, think about how everyone has all these neuropsychiatric symptoms of just anxiety, depression, rage. They're getting diagnosed with all of these things that they're getting on SSRIs and antidepressants, and it could just simply be a mycotoxin. So how are your daughters, if you don't mind me asking? How are they doing?
Boys. I have boys. Yeah.
Boys.
Yeah. And they're good. I mean, one of them is still kind of struggling because of he had the biggest mold exposure in our house. So he was in the room, so that it takes a little while. And also, being 20 and, not having necessarily mom making you all your food, but he's an amazing chef. So I can't say the food's better than I was cooking, but you're also 20, so sleep habit.
Absolutely. Absolutely. So people who are parents, that book that you have, the what I think it was
called, Light in the Dark.
Light in the Dark, that could be a good DIY for them too, to help.
Absolutely.
There's a lot of patients who tell me, and I don't work a ton with peds. I do basic peds, but nothing like, really, in depth, like these type of cases. But they'll say, I think my, child has this or this. And like just someone said to me the other day, And I had just checked their C4A levels that are increasingly going through the roof. And the son is in a room when they found is all this mold in the room. And now he's getting all these like tics and OCD. So it's like, well, there we go. So a lot of times I help the kid inadvertently, their child, because I find mold for them. And then they're like, oh, well, my child has eczema. My child has this, severe anxiety or a tic or a compulsion, right? So, and I thought it was so interesting that we have such a similar story about the Lyme. I didn't know I had it either. And I think my mom gave it to me
Yep.
because I don't remember ever being bit. And I'm not saying I couldn't have got bit. I grew up in Long Island. I probably was bit too, but my mom has Lyme, my sister has Lyme, and I had Lyme. So, so we don't talk enough about how you can pass Lyme in utero. So I always tell patients, if you want to get pregnant, let's make sure we treat you, your bacterial load is as low as humanly possible before, so that you're not increasing the risk of transferring it on. So that makes sense with the PANDAS, because you said it could just be another infection like a Lyme disease, right?
Right. Yep. And if you're, exposed congenitally, now your immune system didn't evolve or didn't develop in a healthy way. It developed to be more reactive.
Right.
So you don't have that normal immune system development.
Exactly. Yeah. And that's why I feel like if I even look back in my childhood, I was like a sick kid, like 12 antibiotics a year, no adenoids, no tonsils, like gotten taken out at 23 years old, because I didn't know any better then. I remember going to the surgeon and I said, if you don't take these out, I'm going to take them out myself. And he was like, okay, because it was he's like, she looks like a crazy lady right now, because it was like on Z-Packs, like going out of style, getting sicker from all of the antibiotics. And they were thinking it was very risky at that time to take out tonsils and adenoids at a 23-year-old. But he was like, thank God I took them out. I found all this antibiotic resistant bacteria. And this is because I think, again, that the C-section baby, not breastfed, then going in with a mother who had Lyme disease, right? So it's important that you look into that mother's health. And a lot of naturopaths will ask, how was your mother's health before? Or how was, right? So that you can try to get an idea of how far back do we need to go, and what do we need to do to maybe support that nervous system or those inflammatory responses? Because then you're like you said, you're on alert for everything. Like if a toxin comes in, it's like your body kind of either hyper reacts or sometimes doesn't even react and can't even do anything about the toxin, right? So I'm happy that you shared that. And I also wanted to talk about, so I went on your Instagram last night, and of course, I don't know, the algorithm, I didn't see a bunch of your posts. So I went and I started watching, and I saw this fascinating one about the guy, I think, who had some colony of fungus in his nose, who had Parkinson's. And this was so crazy because just recently, over the last year, and my mother gave permission for me to share this, I just thought I had to talk to you about this because it's so wild. She literally started getting these Parkinson's-like symptoms, and she finally did a test and it said Parkinsonism, like it wasn't the and I said, this is like, every time I go down, my mother's like neurotically clean, we're Italian, everything is spotless, so like the thought of her thinking there's mold in her home like makes her a little bit like crazy. But when I go down to the basement, because I've had Lyme most of my life, I can smell anything anywhere, and I kind of have this hint of like, I think she's like a finished basement, so she's so proud of it, but I smell this like, that mold smell. And I said, did you guys, he's like, yeah, we did have a leak, but then we fixed it, because my dad fixes everything. And he's like Italian from Sicily, like he fixes everything perfectly. And I said, yeah, but Mom, I think there's mold down here. But of course, I don't think so. And then I just shipped her a total toxin test from Vibrant, and I said, I think there's a toxin causing these neurological symptoms, because she's getting this like tremor in her arm and her leg. And I was like, this is not normal. She takes really good care of herself now. We treated her Lyme. We know that sometimes that can cause Parkinson's, but there was a lot of things that we'd done for her. It was just weird that this is coming up. And just recently the results came in, and it said she had high levels of aflatoxin. And so I did some research, and it actually said they did some research of aflatoxin and Parkinson's. So I would love to hear a little bit more, because I know you shared about that a little bit on your reel, about how this, like you said, lights up our brain in a bad way, and these can maybe start some of these neurodegenerative processes. And when you work on that, I'm assuming then, like you said, your patients or symptoms just start to resolve because the root cause of where it's coming from is addressed.
Yes. Yeah. So that's the basal ganglia connection. So in a kid, it could turn into an autoimmune disease where the body is trying to attack the dopamine receptors. In an adult, eventually that poops out because if the receptors are destroyed, we have too much dopamine. So in a kid, they have dopamine excess. And that's why we don't use things that increase dopamine in a PANDAS kid. But then that eventually downregulates the receptors and the brain gets deficient in dopamine. And so that's why we use L-DOPA and those kind of things for Parkinson's. So it's just the continuum of the same problem.
Wow, I did not know that. So it's basically, it's kind of like how the adrenals, they pump out a ton of cortisol when you're stressed, but then now when you've been stressed for forever, now there's no cortisol. So it's the same concept with dopamine. Because I was wondering, and then she's just taking these, even this, these natural dopamine supportive supplements, and it wasn't doing anything. And I said, yeah, because I think there's a root cause of something that's like, I don't think just giving your body back dopamine.
Right. Why isn't it making it?
Like, why isn't it making it to begin with? So
Yeah.
are there specific ones, like I just found, like the aflatoxin, or can just all mycotoxins do this? Or are there specific ones that are more likely to do it than other ones?
There are some of them can cross the blood-brain barrier through the blood, so they don't have to ride the nose, and that'd be chetoglobicin, eniatin. These are ones that can cross the blood-brain barrier. But if you have a leaky gut, you're going to have a leaky brain, so they can get up there as well. So I think of all mycotoxins as having potential for this. They can, because of their neurotoxic effect, that we just don't know exactly where it's going to have affinity. Some have affinity for the astrocytes, which is the barrier. Some have affinity for the basal ganglia. So, they just have affinity for certain types of neurological tissue that they disrupt. People get gut gastroparesis, which means their stomach doesn't drain very well and their peristalsis is delayed. That's something that mycotoxins can cause because they're a neurotoxin. They stop our nervous system, and it shows up in our parasympathetic by disrupting the parasympathetic. So salivation, lacrimation, so tears. So people have like dry eyes, dry mouth. They'll have problems with slow digestion. All of those autonomic systems slow down because of the neurotoxin. And so we can see, some of the Parkinson stuff too with gait and that kind of thing. And then the sympathetic goes on high drive. And so we see anxiousness. So it's this combination where you think, well, if you just calm down, maybe your digestion would work better. Yeah, it would, except with a nerve toxin in there, then it doesn't matter like how calm you are. It's just impacting the actual neurons and their conduction. So the guy that you were talking about, he had Stachybotrys fungal colonies in his nose, and he had a fungal ball. It's what Dr. Dennis called it. And Dr. Dennis is an incredible EENT in Atlanta, Georgia. So when I read Dr. Brewer's study, I think it was 2013 or 14, that was like, hey, by the way, even though we all have fungus in our sinuses, if we were to test healthy people and sick people, the sick people's mold has become resident and it starts making mycotoxins. And it was wild when he took the fungal ball out of this patient's nose. He had a couple, put it on the Chuck's pad, so the sterile pad, and it continued to make mycotoxins. So there was a ring of fluid around this ball, and he sent that in for testing, and it was mycotoxins. So that's happening. If that's in your sinuses, that's just a bone away from your brain, and these are fat soluble, which means they can seep through with concentration gradient. They'll move to the less saturated area. And so if your brain isn't saturated yet, it'll just move into that place because they want to reduce the saturation pressure. And so they'll move by a gradient to the least saturated tissue. And Parkinson's patient doesn't have Parkinson's anymore.
I heard that. I was like, oh my God, that is, I can't even imagine how through the roof excited he must have been to have this finding, to have his entire life back.
Yeah. I mean, this is one of the things that we can use. The Bredesen protocol is amazing. We can use glutathione IVs and get really far with people. But this is the place where when they hit that wall, I'm like, what's going on in the nose? And I send them for a consult for, check out a Dr. Dentist, because it's so often that some kind of deep-seated neurological problem is resident fungi colonizing in the nose. That shouldn't be there.
And
if we find them in
yeah,
your nose, usually it's just because you breathed them in, and then your
right.
own mucosal layer and, snot is very digestive. So usually it would break it down and just not let it to allowed to be there. But if it's, setting up mycotoxins, they're also immunotoxic, which means they deplete the immune system. So now the immune system on the surface of your sinuses can't get rid of those guys, and they become invaders.
And do you think and there's a company, Microbiology DX, that do these nasal swabs that check for either Marcon's fungus or bacteria for someone who can't get, to a doctor? Is it something that is good because it will tell you the fungus and then the potential biofilm? Have you ever used those before?
Yeah, I use the Microgen DX, the one that the next generation NGS PCR testing, so that we can find out who it is. Yeah, and if there are any resistance genes. Yeah.
Got it. Okay, that's good to know. And when you say the word, so when we talk about, well, how do you treat these people in general, whether they're just acute mycotoxin, chronic, they have gone now into this potential really, severe neurodegenerative process, Parkinson's or all of that, is that where you consider, I want to talk more about this precision mold treatment that you talk about. Yeah. So where do you start with these people? Like where, I want to talk a little bit about how you talk about how foundations are important, and then a little bit about some of your supplements, if you feel like those would be a good place to start for some people, especially obviously the dosages in your book. But I'd love to talk more about like, where do you go with these people and like, where do you start?
Yeah. So getting out of mold is number one. Like in my mold book, I have the peel the orange is the 5 tools are laid out like an orange. And people are like, orange? I thought it was onion,
Exactly. Where's that citrus now?
So,
an onion now or an orange.
Yeah, but orange tastes better. But yeah, so the idea is that you have to peel the entire outside to get any progress. So in an orange, you would peel the orange layer and the outer white fluffy layer. So that's avoidance is the orange layer. Like that has to be done 100%. You wouldn't eat the orange, although we probably should, with all of the peel on it. Most of us want to get all that off because then we eat the sections. And then the sections are, so the 5 steps are avoidance, do the fundamentals next. So that's the white fluffy layers of as much as you can do that 100% also. And it's all the things we teach our patients, think biohacker, basically.
Yep.
And then being on a diet that is specific to support mold and to reduce your mycotoxin load, and that has really high binding capability in your diet. And then the next is to protect the tissues that are being damaged currently so that you can repair things like the immune system so that you can use antifungals as the 5th step to reset that microbiome. So that might be natural stuff, that might be pharmaceutical, it's different for everybody. But in the fight layer, the antifungal layer, I use also antibiotics. So silver is a really nice one that I use in the nose because we treat the nose and the whole systemic because the nose can reseed the problem. So if you're not addressing that first interface, that first experience that you have with a moldy building is breathing it. So we have to protect that area and get it reset. So that's kind of the talk through like the overarching plan or approach, therapeutic order that I use. And so when we're talking about precision, then the protect and repair part is like, how do we get these mycotoxins out of the body? Right. The antifungals are stopping their production. So if you do have residents that have moved in, which means you're colonized, they're continuing to make mycotoxins. So if we go in with antifungals first, we've learned that mold will fight back by making more mycotoxins. So we can actually make someone flare in whatever their symptom is and really challenge their organs of detoxification if we don't clear the toxins first. So in the precision idea is that we do those fundamentals, that are supporting the systems like vitamin D. We know that mycotoxins block vitamin D. They downregulate the receptors. So most people exposed to mold are going to need some vitamin D. And vitamin D runs so many of our hormone systems and balance and that kind of thing. It's hormone D more than it's vitamin D. So if
Right.
that's not working right, then the systems aren't communicating with each other. And vitamin D is critical for immune system. So if mycotoxins are depleting your immune system, we need that vitamin D to be optimized so that your immune system can run to its full function. Otherwise, that antifungal part doesn't work as well. Really any kind of antifungal, whether it's herb or drugs, what they're doing is impairing the fungus so that your immune system can come in and finish the job. So we need your intact immune system. So that's kind of the fundamentals. Where we get precise and what I'm super excited about, like I spend weekends reading papers on chetoglobicin. Like that's just like,
That's what you do when you're a naturopath.
yeah, obsessed about it. And what it turns out is that each one of these molds makes multiple mycotoxins, and they have different ways that they get out of the body. So the idea that we're going to just put everybody on a binder and get them better is
Right.
not actually addressing the issue. Some and many of the mycotoxins choose the kidneys first as their preferred way of getting out of the body, not the liver. And if we're doing a binder, that's actually addressing the liver pathway. It's not addressing the kidneys at all. So actually, for the kidneys, what we need is a non-binder. We need something that's going to help the mycotoxin get off of blood protein so the kidneys can clear it. And without that, anti-binder, so to speak, then the kidneys have to sustain damage. They have to donate that nutrient from their own tissue in order to get the mycotoxin out. So I'm really excited about being as precise as possible because we have good testing. Like you talked about the vibrant urine mycotoxin. There's my MycoLab blood antibody tests for mycotoxins. I like to see both because they're both sort of testing different aspects of mold. Like, what does your immune system think about it? What's your body load? That kind of thing. And then we can say, okay, these are the mycotoxins that are high. I have kind of a priority of which ones we want to get out first if we see a mix. And we can be very precise in getting that out by following the exact pathway that mycotoxin uses and support that pathway. So we're getting at it much faster, which is what I'm very excited about because they can cause cancer, they can cause dementia, they can cause birth defects. Like, this is not something to sort of mess around and just wait for your body to get it out. Like, we want to be really aggressive. And so that's where the products came up as I trained more doctors, like you see, like naturopaths, we love to play with our little medicinary, like I like to mix things. We have an encapsulator, so I'm making individual capsules for my patients based on what I'm finding on their labs and what they have going on in their body. Not everyone's going to do that, of course. So I had tons of doctors saying, would you just create something, make capsules or whatever you're doing in mass so that we can have what you're doing and make it easy on us. And so that's where Alight Health Formulas was born. Was like, okay, I'll try and figure that out. Like, I don't know how to do that, but
Well, you did because we used it and we used it on a patient. So Dr. Sparks in my practice, it's just me. So I own my practice and then Naturally Sue Wellness, and Dr. Sparks is, like, I call her my right-hand woman.
yeah,
She did Dr. Jill Crista's mold certification course because she was just getting obviously too high demand, and she's one person and she also has to sleep, right? So you needed to eventually give all this amazing information in your brain to other people. And so other practitioners. And so she did this mold certification course, and she's been seeing so many patients in our practice who have mold illness. And like you said, doing your process and that, like you called it, that precision, knowing what it is, being able to be very deliberate. And we did have this one patient who we decided we just signed up for the Alight formula. And we ordered her, I think it was just like the basic mold. It was like a multivitamin. And this is where it's so important because people come to naturopaths and want this fancy stuff. And I'm often literally putting them on like a multivitamin. And then literally there's, sometimes they're like 75% better because all their body needed was the building blocks.
yes.
And so it doesn't need to always be these fancy things. And let's just say you can't, at the moment, you're not in the financial capacity to test all these amazing tests. That's where I've seen, I don't know if you agree, just from my own intuition, I'm like, okay, I'm just going to do some drainers. I do a lot of biotherapeutic drainage,
Yes.
opening up their among trees, just opening up their liver and kidney injuries, they feel 10 times better. Even some of them being in the mold, just because at least their body can drain out whatever is coming in. But I did want to speak to that. The products that you are making, they may not seem like a multivitamin, may not seem so fancy to you, but that actually, our patient said, wow, I'm actually feeling a lot better. And it was a multivitamin, you
Right.
know? And of course I know like your formulation is not just, you know, a simple multi, but it's kind of
Right.
is simple. It's a multivitamin, right? It's designated
Yeah.
for people with mold to just give them those foundations. So I'm really happy you did this because it's
Yeah.
super,
Thank you.
super helpful to have this. Also knowing that we kind of get your brain in when we, you know, inadvertently when we're working on patients, like, oh, this is what we'll do next. And I think you said you do consults right now. You're not seeing just some of your like old time patients, but you're not taking on new ones. That's why you've
Right.
certified people. But you said you're also doing peer to peer consults. So if you are a naturopath listening to this, you'll do some consults for them. And then you also said you do a monthly masterclass for people who want to talk and discuss mold. Yeah, can you share a little bit about this masterclass you have?
Yeah. So it's a way that I have a lot of people that have read my book, just regular members of the public that are just like, okay, I'm this far much farther better, but I'm still struggling with XYZ. So salicylate sensitivity or oxalate sensitivity or long haulers or how exactly do I do a nasal spray and what does that look like? So I basically went down the list of my most common questions and I thought I want to create these classes that are really interactive and that it'd be a way for someone to be able to interact with me even though you're not a patient because I just don't have that available. So it's group learning. But the nice thing about group learning is that people are asking questions that you didn't even think you needed to know. And I love that part about group learning, that there's this awareness of like, oh my gosh, I didn't even think to ask that question because I have that symptom too. And I didn't know that that was related or, those kinds of things. So yeah, they're 2 hours and very interactive. It's not just me, a talking head talking at you. There's, breakout rooms and question and answer and all of that. And when I wrote down all the topics, I have 4 years of classes planned. So
Wow, and I'm sure now they're all asking questions. You're like, oh wait, that's another thing I should talk
yeah,
about.
yeah.
So
Well,
it's
I
like
learned that.
helping you
Yeah,
thinking of more topics. And then when you're in an interactive group, you're just learning from each other and having the support of feeling like you're not alone. So I
that's
love
the
that you're
biggest
doing
thing.
that. Yeah,
Yeah, that's the
because
biggest thing is people are like, you have that too? I have that.
yeah.
Like in this last one with oxalates, people, one of the breakout sessions, they were like, she didn't really talk about the hearing part, but I have, maybe it's an odd one, but I have otosclerosis. And like 3 other people in the group was like, I have that. I have that. Is that connected to this? And then when they came back to the whole session, could ask me and I was like, "Oh yeah, it is actually." And I had it off my list. So let's get it on so, we're also refining that so that we're catching more people that have what seems like an oddball condition, but is actually really common with mold.
Yes.
So it's very reassuring for people that they now have community and so I'm hoping, it'll help people bond and connect and yeah. But
Yeah, I'm
mainly
sure
I
they
just
love
want them
it.
to have the resources. Yeah.
Yeah, absolutely. Because when you're telling this to someone maybe in your family or your friends, they're like, "What are you talking about?" "Oh yeah, we all have mold. There's mold here. This is this." So they no one like they kind of just undermine you and then they make you feel like, especially I don't know about you, but like when you feel like, "Oh, I finally found what's making me sick," and then someone else undermines it, and then you kind of just feel like that all your spirit and you're just kind of just like your soul just feels so sad after that. So to be
Yeah.
able to be in a group and hear other people having these quote unquote weird or different or not as common conditions is so helpful. And I know we're at the hour, but I want to ask you just two other quick questions if that's okay. What is your experience with the people who are having like that struggle either losing weight or feeling like they can't they're either trying to lose weight or they're either gaining weight rapidly, and do you feel a lot of them have had this toxic environment that they've been in and there's just an inflammatory component of that?
It can be partly inflammatory, like a SIRS picture, but also we know that these mycotoxins disrupt leptin. I have patients who really struggled. And I found that UV light, So UV is really important for, um, it's called leptin resistance, which means the cells aren't listening to leptin anymore. So UV light will sensitize the cells to leptin and propolis. And what I love about
Oh,
it is it's
interesting.
antifungal. So it's like, oh, here we go. We can feed many birds with one seed. Again, in naturopathic medicine, it's like we just do things so differently, and we have accidental successes in things because we were using something that has all these other benefits. So
Oh,
propolis also had action against COVID. So yeah, I mean propolis is amazing, amazing.
oh, that's awesome. I'm so happy I asked you about that. I knew that. I was like, "Oh, goodness, if I ask, that can open up another
Yeah.
45 conversation of weight loss," but that was perfect. It was like, do
Ooh,
some UV
yeah.
light, and when you say UV light, like, give the listeners some examples of, like, for example, what would you tell them to do?
I'm probably one of the few naturopathic doctors is telling you to go to a tanning bed.
Oh, wow, yeah. Doctor Mercola tells everyone to go to tanning beds. He's been saying it for years.
Yeah, yeah.
So, yeah, go to a tanning bed.
Yep.
Yeah.
So I
Is there a
have people
certain
use
going
yeah, I have
Uh-huh.
people use the color guard. So I've used that mix forever. Not in one capsule. I mean, in my own medicinary, I get to make it. But
Yeah.
if I was doing telemed or something, I would kind of build it with like 4 different bottles of things. But I have them use the color guard to protect from the antioxidant piece or the oxidative piece of the tanning bed. We might bump up their vitamin E also if they're like a post-COVID person who needs a little more glycocalyx protection. But yeah, just like go and get tan. Like
Oh, I love that.
there's ways to do it safely. Like with the color guard, it's a mixed antioxidant formula that not only did we hit every mycotoxin, because that's why the formula is the way it is, that there are bioflavonoids that are specific for certain mycotoxins in the research, but also it's a mixed antioxidant that has benefit against UV radiation. So you can take the color guard and then go hit the tanning bed and take some propolis and help with that leptin resistance.
Oh my goodness, this
Good
is
old
so
sun.
exciting.
I
So
mean, ideally,
basically,
you would
have
get
permission.
all
Yeah.
the sun, like get in the real
Yeah.
sun. But,
Yeah.
if you're in the Northeast in winter, like how are you going to do that? It's too cold. So,
Yeah, that makes perfect sense. And your color guard is your kind of multivitamin, correct? It's kind of like
different.
that.
Yeah. So the
Oh, it's
mold
not.
multi is, I know it sounds very simple, like, oh, it's a multivitamin. But what I did is I took specific nutrients when I looked at mold, mast cells, fragments, so the allergic part of it, and then every mycotoxin. And I did this big spreadsheet. What are the nutrients we know that one depletes, that one depletes? And I took like the 80%. So I even looked at like, how do you get oxalates out of the body? So making sure that there's things that like nobody's talking about, which drives me crazy. Like, by the way, if you're listening, you have an oxalate problem, get your vitamin K optimized. Only naturopaths
Mm.
talk about this kind of stuff. And then you get these like, you can't use glycine with oxalates, these like legends that are going around. And that's actually not what the research shows. It shows people who are glycine deficient end up with kidney stones. So please trust a doctor on some of these things. But I looked at all of those nutrients and I was paying attention to some of those things, some of those, what we would call an oddball reaction, but are really common with mold. We know there are nutrients that play into supporting the systems in that person. So that all went into the mold multi, and that's part of the foundational step of treatment in the protocols, those precision mycotoxin protocols. And then the color guard works for the mycotoxins that use the kidney clearance part. Yeah. So ochratoxin, citrinin, zearalenone, it just like flushes those right out the kidney. It's wonderful. But it's also
This
good
is
for inflammation. So
Yeah, yeah. And
people
can
are
people
like,
just
"Can I stay on this?" Like, yeah, I take it every day. I do.
So you yeah, it would just be helping, and I'm assuming the
Yeah.
people who have when this all of a sudden like, "Oh, now I got diagnosed with, mast cell." In my experience, you get diagnosed with mast cell because you've either had this is my experience, chronic Lyme, chronic mold, chronic leaky gut,
Yeah.
chronic trauma, and so, like, it's a syndrome. It's kinda like that same IBS or like, "Oh, it's a syndrome." It's like so
Yeah.
with people who get these mast let's just say the person has they don't have a lot of mold, would they even just with some of the products, like, could they even just benefit from your multi in general because of just the help with mast cells, do you think? Or, like, what do you
Yeah.
think there?
Probably not the mold multi, but I would be thinking like the nettle histone. And
Okay.
then because that's really directing the mast cells. The
Mm-hmm.
other thing that we have that's very unique and not very many people understand this research is our gentle bind. We have a binder that's using aloe, long chain polysaccharide aloe. We're just reformulating that right now too to add some lemongrass and some okra because that binds trichothecene. So we want to make sure and hit trichothecenes prefer to leave by the intestines. So we want a binder that's going to be addressing them and the things that bind those. But aloe is a potent mast cell stabilizer. So a lot of times if
Oh,
somebody's having mast cell activation problems, whether it was from mold or not, we put them on that binder and they're just like, I don't know what just happened, but like, I think things are calm. And I'm like, that's aloe. That's not a mistake. Nettles do the same thing. Hops, like some of the things that are in our nettle histone. It's not always histamine. Mast cells can secrete thousands of inflammatory molecules. So we want to stabilize the mast cell, not just do a lot of antihistamine, because that's not
right,
addressing leukotrienes, chemokines, cytokines. That's only
right.
addressing that one thing. So, which is helpful, but it's missing the boat. So when we go to aloe is stabilizing the mast cell, vitamin C does, nettles do. So they don't even leak out all of the things. So we're trying to keep everything inside the mast cell.
That makes so much sense. So just
Mhm.
few last clarifying questions. So if someone were to, because we'll tell people, do not just go on a binder at some random times where it's obviously very, individual and picked for a specific time of where they are, especially if they're constipated. But let's just
Right.
say we're even in the beginning constipated with the gentle bind. Would that be okay even early in the process
Yeah.
versus okay, so that's great to know. So if someone wanted to do a binder and they were like, I don't know, I don't want to make myself worse because a lot of people get worse.
Yeah.
The gentle bind that has aloe is
Yeah.
non-constipating and gentle enough that even people who didn't have mold, let's just say they have mast cell issues or I don't know, maybe Lyme disease, that can also help. That's great to
Yeah.
know. And I love that you said about the mast cells, they don't just, right, there's not just histamine, there's other inflammatory,
Mhm.
you know,
Mhm.
chemicals that are also being secreted. So a
Right.
lot of times you're seeing that when you work on this precise mold treatment, then their mast cell activation syndrome just suddenly doesn't become so,
Yeah.
disabling, right? Where
Right.
what are you see like the most mast cell symptoms? You see like a lot of anxiety, gut stuff, headaches, or like skin stuff. Is that
Food
where you were
triggers. Yeah.
food trigger?
Mhm.
Yeah.
Yeah.
Oh, yep.
Yeah. So it's yeah, and then we could we need like another hour. Uh
I know. Okay, I was trying to like push it all into one. I think I at least got my most important question answered. Maybe we could do a part two and we'll talk about mouth cell.
Right, right. Yeah, because that's all interwoven into COVID also. So,
Yeah.
the spike protein is so it will go to the ACE2 receptor. There's and a second receptor that responds to nicotine, but the ACE2 receptor is highly expressed on mast cells. So mast cells are one of the highest ACE2 receptor molecules or cells in our body. So if you have a lot of spike load too, it's going to trigger the mast cells. So mast cell
That's
is like there's, mold, parasites, COVID. And I think of those 3. Mhm.
well, if you'll come back, maybe we'll do
Yeah, we'll
a
have
we'll do a COVID mast cell because I'm sure everyone wants to hear about that because, there's still people saying, I feel like I have long haulers and I feel
yeah,
like I have
yeah.
COVID. So I would love this has been so delightful. I am
For me,
so happy to have had you here. Please, everyone, follow Dr. Jill Crista. It's Dr. Jill Crista, Crista on Instagram. She has 2 awesome books out, Break the Mold and then A Light in the Dark. She's working on her next book. You can get her 2 books, I believe you said, on any book type bookseller website. She has the audio out. You can go on her website. What's your website?
drcrista.com, drcrista.com.
Perfect. And then if you are a naturopath listening, you can ask for a peer-to-peer consult. And then you have this amazing monthly masterclass. So if you're feeling alone, like you need some clarity, like you want to have a sense of community and really learn more about this, if you are either working with a practitioner and need support in between, or if you just want to DIY it, you can definitely do her masterclass. Is there any other last things you want to share about mold? I know I tried to squeeze as much out of you as possible today.
That's great. No, I don't think so. No,
I
thanks
think
so
you
much
got
for
it all.
this opportunity.
So welcome. Thank you so much for being here.
Thanks so much for listening to Modern Day Naturopath Podcast with Dr. Sue.